Welcome back. We're on step 4 of the 5 steps to effective prescribing of behavior meds. So hopefully you've been following along, but all of the videos are on our YouTube channel. So if you've missed steps 1 through 3, no worries. You can find them all there. So step 4. So how do you start to make decisions about what to prescribe? This is where people get really flummoxed. These are the do's and don'ts. Number 1, base your decisions on clinical signs and desired outcome. When my residents come to me and say, Dr. Adasta, I have this patient, right? And they present the patient so perfectly. And then they say, what medication would you use? I say, I don't know. What are the clinical signs? And what is your goal for the patient? That is what you need to ask yourself. What does the patient look like now? Lunging, hiding under a chair, destroying the house? What do you want the patient to look like? And you can't just say calmer or better. You have to describe it. Out from under the chair, interacting with people. All right. So you're going to make decisions based on clinical signs and desired outcome. You're going to base your decisions on latency to effect of the medication and duration of effect. When a pet comes into you and that pet has separation distress and the pet parent says, I cannot leave my house, I'm a prisoner, you should be thinking of long-acting meds such as Reconcile and Clomicalm. And you also need to be thinking of short-acting meds, because if you just send Reconcile or Clomicalm home, it's going to be 6 weeks before that pet or that pet parent gets any kind of relief, and that's not acceptable. Okay? Do start low and go up, no matter what it says in that formulary you have on your phone or on your shelf. If you still like paper formularies, start low and go up. Behavior meds are not consistent, nor are they always predictable. Here's the thing. Don't make a decision based on the diagnosis. So how do I then choose what to prescribe? First, I'm going to look at the clinical signs. So this is a patient with separation distress, right? Single working parent, 2 school-age kids. The dog is destructive, urinates, defecates when alone. So what we want, what is our desired outcome? What's our goal? Decreased stress, decreased destruction, decreased urination, decreased defecation. So how will I make that medication choice, right? What medications or supplements can cause the desired outcome? Let's run through that. So here's my goal: decreased stress, urination, defecation, and destruction. I'm going to split those into 3 separate compartments. First, if I want a pet that has an overall decreased stress response, so less fear, less anxiety, and less stress, I'm going to be looking at those benzodiazepines, at gabapentin, at pregabalin, for example. And this presumes that this pet is not in any way aggressive, okay? What if I'm looking at the clinical sign of decreased urination and defecation? That pushes me toward Clomicalm. Clomicalm has as an effect increased urinary retention and fecal retention. It may work for this patient. And I'm blocking this pink square, so I'll tell you what's in that square. If I want decreased destruction, less movement, just calm, where I'm looking at trazodone, Clomicalm, Reconcile, acepromazine, clonidine, Cilio, lots of choices. So I want you to see that by choosing an outcome, really defining what you want, you get lots and lots of choices. So how do you choose? I usually choose a medication or a supplement that shows up in several of my boxes, right? So in this case, I could use Clomicalm and clonidine. I have a lot of choices. Medications and supplements that modulate glutamate induce calm and reduce anxiety. Medications and supplements that modulate GABA help pets be more outgoing, happier, and they also reduce anxiety. Stay tuned for step 5. That'll come next month, where we'll be making effective medication changes.